7 Warning signs of type 2 diabetes. Type 2 diabetes symptoms can be mild and hard to recognize, if they occur at all. But these are the most common signs in men and women. More than 100 million American adults are living with prediabetes or type 2 diabetes, according to the latest estimates from the Centers for Disease Control and Prevention, CDC. But the number of people who know they have the diseases, which can lead to life-threatening complications, like blindness and heart disease, is far lower. Data from the CDC suggests that of the estimated 30.3 million Americans with type 2 diabetes, 7.2 million, or 1 in 4 adults living with the disease, are not aware of it. And among those people living with prediabetes, only 11.6% are aware that they have the disease. Prediabetes is marked by higher than normal blood sugar levels, though not high enough to qualify as diabetes. The CDC notes that this condition often leads to full-blown type 2 diabetes within 5 years if it's left untreated through diet and lifestyle modifications. Type 2 diabetes can lead to potentially serious issues like neuropathy or nerve damage, vision problems, and increased risk of heart disease and other diabetes complications. People with full-blown type 2 diabetes are not able to use the hormone insulin properly, and have what's called insulin resistance. Insulin is necessary for glucose, or sugar, to get from your blood into your cells to be used for energy. When there is not enough insulin, or when the hormone doesn't function as it should, glucose accumulates in the blood instead of being used by the cells. This sugar accumulation may lead to the aforementioned complications. You can help assess your chances of developing type 2 diabetes by requesting an A1C test from your doctor, as well as by talking with your family about their health history with the disease, as your genetics may influence your risk of diabetes. Other risk factors of type 2 diabetes include obesity, inactivity, old age, a personal history of gestational diabetes, and race, according to the Mayo Clinic. For instance, if you are Hispanic, African American, or Asian American, you may be at a greater risk of type 2 diabetes. Nevertheless, you can prevent prediabetes and type 2 diabetes by maintaining a healthy weight, following a healthy diet that's rich in whole grains, fruit, vegetables, and lean protein, getting sufficient sleep, and exercising regularly. But preventing the disease from progressing if you already have it requires first being able to spot the signs and symptoms of diabetes when they appear. While some type 2 diabetes symptoms may not ever show up, you can watch out for the following common signs of the disease and alert your doctor, especially if you have any of the common risk factors for diabetes. Also keep in mind that while most signs of type 2 diabetes are the same in men and women, there are some distinctions. Warning sign number 1, frequent urination could be related to diabetes. When there is excess glucose present in the blood, as with type 2 diabetes, the kidneys react by flushing it out of the blood and into the urine. This results in more urine production and the need to urinate more frequently, as well as an increased risk of urinary tract infections, UTIs, in men and women. People with type 2 diabetes are twice as likely to get a UTI as people without the disease, and the risk is higher in women than in men. If you notice you have to go to the bathroom more often than you used to, including perhaps needing to get up every couple of hours during the night to urinate, and you seem to be producing more urine when you do go, talk to your doctor about whether you could have type 2 diabetes. Warning sign number 2. Increased thirst or a dry mouth may signal diabetes. High blood glucose sets up a domino effect of sorts within your body. High blood sugar leads to increased production of urine and the need to urinate more often. Frequent urination causes you to lose a lot of fluid and become dehydrated. Consequently, you develop a dry mouth and feel thirsty more often. If you notice that you are drinking more than usual, or that your mouth often feels dry and you feel thirsty more often, these could be signs of type 2 diabetes. Warning sign number 3. Uncontrolled diabetes may trigger unexpected weight loss. When you have type 2 diabetes, your cells don't get enough glucose, which may cause you to lose weight. Also, if you are urinating more frequently because of uncontrolled diabetes, you may lose more calories and water, resulting in weight loss, says Daniel Einhorn, MD, Medical Director of the Scripps Whittier Diabetes Institute and Clinical Professor of Medicine at the University of California in San Diego. Warning sign number 4. Feeling hungry all the time also may be a diabetes symptom. People with type 2 diabetes have insulin resistance, which means the body cannot use insulin properly to help glucose get into the cells. In people with type 2 diabetes, insulin doesn't work well in muscle, fat, and other tissues, so your pancreas, the organ that makes insulin, starts to put out a lot more of it to try and compensate. This results in high insulin levels in the body, says Fernando Avale, MD, director of the Multidisciplinary Diabetes Clinic at the University of Alabama in Birmingham. This insulin level sends signals to the brain that your body is hungry. Warning sign number 5. Foot pain and numbness may be a sign of diabetic neuropathy. Over time, a prolonged exposure to high blood sugar can damage the nerves throughout the body, a condition called diabetic neuropathy. Some people may not have any symptoms of the damage, while others may notice numbness, tingling, or pain in the extremities. At the beginning, diabetic neuropathy usually starts in the feet and then it progresses upward, says Dr. Avale. Although most common in people who have had type 2 diabetes for 25 years or more, it can occur in people who have prediabetes as well. In some studies, almost 50% of unexplained peripheral neuropathy in the extremities, whether painful or otherwise, turns out to be caused by prediabetes or diabetes, says Dr. Einhorn. Warning sign number 6. Frequent infections and feminine health issues could mean diabetes. Because both yeast and bacteria multiply more quickly when blood sugar levels are elevated, women with diabetes are overall at a higher risk of feminine health issues, such as bacterial infections, yeast infections, and vaginal thrush, especially when blood sugar isn't well controlled. And a lack of awareness about having prediabetes or diabetes can make managing blood sugar impossible. In men and women, foot infections are also a common symptom, because the disease can damage the architecture of the foot, including the skin, blood vessels, and nerves. But Einhorn says foot problems are usually seen more frequently in those with advanced diabetes. Warning sign number 7. Blurred vision could be a result of rapid blood sugar changes. The lens of the eye is a flexible membrane suspended by muscles that change the shape of the lens to focus the eye. In a high-sugar environment, such as with uncontrolled type 2 diabetes, the lens's ability to bend is altered. Although the lens is not damaged, the muscles of the eye have to work harder to focus. Blurred vision occurs when there are rapid changes in blood sugar, from low to high or high to low, and the eye muscles have not yet adapted to it, Einhorn says. Blurred vision is one of the early warning signs of type 2 diabetes. The body later adapts to the sugar levels, and your vision will go back to normal. Sometimes medication is an option as well. Metformin, glucophage, Glumetza, others, an oral diabetes medication, may reduce the risk of type 2 diabetes. But even if you take medication, healthy lifestyle choices remain essential for preventing or managing diabetes.